Hello, everyone. Hello, Teja. Here we are doing the patient neurologist, or you see, I don't like the word patient, and actually in the Functional Neurological Disorder Society, Catherine Gill, one of the amazing speakers who presented the patient session. I don't know if you were able to see her, but she said like, hey, I I don't think we should call them ourselves patients. I think we're service users. We're using a service, and I think we're clients. Clients of, yeah. So clients of a service whose mission, whose responsibility, whose duty, the healthcare system, is to teach, because doctors have to teach about the disease they are diagnosing, to teach and to heal and to help and to support, right, Teja? So let's call it client and neurologist, client and educator sessions with Teja Zeribi, who is studying her master's in clinical pharmacology right now in England. You want to say anything? Well, actually, I think we can merge the introduction with telling us introductions and telling us a little bit of what you do with the topic already, because the topic is today's topic number 2 of the series of 8, facing professional academic life with FND. I'm graduated, but you are studying, you're forming yourself professionally. In a moment, build your patience. In a moment, you're going to tell me about this. Tell us, all of us, about this and about what you're studying in England, where in England, and all of that. But just to remind the audience and remind ourselves that the conversation will be performed in an integrative manner, considering cognitive thoughts, emotions, considering the physical body, and considering our role in society, life's mission, realization. So these 4 neuronal or existential networks in an experiential manner. So we're not going to be talking about emotions and about these things. We're going to be feeling them in our bones. Sometimes we'll take breaks. Right, Teja? Okay, tell us about what you're doing and what are we talking about today? Facing professional academic life with a functional problem.
Yeah, so I'm 21, but I've been diagnosed since I was 17. So I've navigated kind of high school through undergraduate and also, working part-time and full-time, and then also now in the program I'm in now. And I've noticed a lot among other patients and myself that figuring out how to navigate like my goals and what I want to be and like having structure in life. And also like, is this the right time? Am I doing it in a supportive way? Can be a really difficult conversation and decision to make that doesn't always have a clear right answer. And I know for me, there have been times where I've had to take time off school for my health, and that has been really impacted me because there's a lot of like societal stigma on taking time off, as well as my own personal, like I've always been someone who loves school, who loves structure, and really struggled with the decision and also knowing when the right time was to come back. So I think that was the idea behind the conversation. But right now, I'm in Brighton, which is like 45 minutes by train from London, south coast of England. And I'm at University of Brighton and I'm studying pharmacy and independent prescribing. I went in with I've always been interested in medicine. And I kind of decided to go that path after working as a nurse assistant for about half a year. But I was originally going to go to med school, but decided on this path instead. And yeah, it's been a journey of navigating when when to take time off school, and when I'm in school, how to do it successfully for my health and for myself as a person, but also my academics, and also professionally, like working as a nurse assistant. It's very physically tiring, and learning how to navigate that long days. So
Wow, really nice, interesting questions. You're so smart. Okay, let's see how we're gonna these. Um, support, support. In the cognitive, you're young. So it's like, okay, guys, I'm in this new world, professional world. So I have all these goals. And how do I make them happen? What is the structure? What is the right time to work and to rest? How do I live life? How do I function well in this transition? So who do we talk about it with? Because they are not teaching it in schools, even in your program, that maybe you don't have anyone. And maybe the person that is there doesn't have the mind, body, emotions, environment approach, and doesn't have any understanding of functional health, which is a problem because you're talking to someone who only knows a little bit, is kind of lost about the reality of living. So how do we get that support figuring things out in this professional development period? Who do we talk to? So I can give you my example, but I want to hear yours. Who do you have? Who is there? Maybe I'll give you my examples also.
yeah, that's really interesting. And I also, I part of me thinks like that's not even an FND person, like a person with FND is a
Exactly.
different question, right? As you transition through life and have different responsibilities and different levels of independence, especially like I feel like the transition from moving away from home, where you're living by yourself, responsible for creating your own schedule, taking care of yourself, that's a big transition in responsibilities. So that was definitely a really hard transition for me, going from, having a lot of support. I had very, very involved parents to, navigating that by myself. And then you had doctor's appointments and, the physical experiences of FND, and it complicates things so much. But one thing I love, love, love about my current program, and I don't know if it's specific to my program in university or if it's a UK thing, but they provide so much structured support, whether it be academic, whether it be emotional. So every student is assigned an academic tutor that they can go to for concepts they're struggling in, for support in creating, you know, study habits, that kind of thing. And they're actually a lecturer in the program. So my personal academic tutor is someone who gives lectures, and is actually the year lead for my year. And then we also have what's called a student success guide, and that's who you go to for, stuff outside of academics that's really difficult to manage, or if stress is contributing to academics. And they provide a lot of like emotional support for students who might not have things that are within like expected experiences of university. I hate to use the word expected, but more generic. They're not like mental health providers or things like that, but they can provide support for common things that comes as they transition. And then what I really love about my program is I have what's called a learning support plan. So I've been given a disability advisor to help me navigate, what accommodations I need, and they've been super great. But as part of my accommodations, they've actually provided me with what's called a mentor. And she basically fulfills a lot of what I feel like you're describing in terms of creating structure and support, and not telling me, but supporting me in taking care of myself and being an adult, and like setting goals for learning how to do that by myself. So, for example, like I really struggle with anxiety, and creating clear how much time needs to be spent on what, and to prioritize what, because I can get really wrapped up in the list of assignments that I have, and spend too much time on things that don't really need that much attention, or get really anxious about assignments that's due 2 months from then, and it's reasonable to be anxious, but I can break it down. I don't need to do it all in one night, that kind of thing. And setting better sleep habits, like nutrition habits, that kind of thing. And she's been really, really helpful. And she's not a like healthcare provider in any way, but she really helps me set goals and check in with her about like, hey, like I'm really working on creating a schedule this week for everything I need to get done. Here's how much time I'm thinking about spending on each thing. And here's how I'm also adding time to take care of myself.
So much good information. I was
Yeah.
like, okay, we need a pause because it's like too much information. I'm having time
Yeah.
to
Sorry,
process
sorry.
it.
I was
No, no.
finished with her, but yeah, the university
Uh-huh.
does.
I was afraid that you were gonna add more
No, no, no,
professionals.
no.
I'm like, okay, hold on. Before any more,
No.
I need a pause.
Give a speech.
You're very good with your communication, with your words.
No.
So let me point out a few things. You see, I teach because we all must have good capacity to read the speaker. You are speaking now, you are having a good capacity to read the speaker, me. Extraverbal language, which is body. So this is the first thing that I'm gonna say, body. I want all of us to remember physical body. I didn't hear that word a single time in the tasks that all the providers address. I heard a lot of cognitive tasks. Awesome. Success is life, mission, and spirituality. Awesome. I heard the word emotions. Awesome. I didn't hear a single time the word physical body. And we
Mhm.
know that functional problems show through the physical body. What are you feeling in your physical body now?
Right now I'm feeling pretty grounded, relaxed, like my arms feel kind of heavy in a good way, like they're resting on my legs. Um, yeah, I feel very relaxed. Um, yeah, I think that's hard for universities to do. You know what I mean? But I do think that's important in finding external support. Absolutely.
Exactly, exactly.
Yeah.
So either you are suggesting you're very smart, you have a cognitive, powerful cognitive mind. I would, anyways, a very powerful cognitive mind. I was going to compare it to the other networks, but I'm like, no, why? But your cognitive mind is, whoa, so powerful. That what you're bringing up is the need for everyone to have a good functional understanding on the physical body, in addition to the emotions, the cognitive mind, the spirituality success. I also heard you suggest subtly that these transitional specialists with a good functional health integrative background are needed, but not only during this stage of your 20s professional development, but how about midlife crisis? How about menopause? How about marriage? Huh? How about
Absolutely.
childbirth or adopting a child or whatever around parenting? Right? So a transitional, a transition specialist. But let's go back and good connection with your body. That was quick. That was awesome. Um, let's go back and we continue connected to our bodies, our emotions, our cognitive mind to why did I bring up the extraverbal language thing? You said my parents have been of great support. And if you're watching the video, you can go back and see if I get it right. You said, no, yeah, I'm talking to the people who will be watching the video, but you said, my parents are of great support. And then doctors came into the picture. And then I
I,
started going to the doctors and doctor's appointment. I mean, you said it. My parents were of great support. And then I started going to the doctors and having doctor's appointment. And I'm like, okay, wait a second. I didn't hear anything about the doctor supporting you, right? Like, this is
I
another
think what
problem.
I meant is as the transition away from parents helping with like independence and things like that as you move to college. That's hard to begin with. And then you add that, you know, as a patient, you have to navigate the medical world and, you know, have a lot of external besides academic and social life
Exactly,
factors
exactly.
is what I meant to say. But I didn't mean, yeah, yeah.
Yes, and how are they? Because doctors are supposed to be providing great support in
Hmm.
transitional periods, especially when you talk about general practitioners are the frontline doctors who are supposed to also working on health and disease prevention. But we don't have to get to that today. But I am like, our doctors, and this is a conversation for all of you out there. Do you feel that doctors are supporting you in your key transitional moments? And especially when you go to them having a functional discomfort. And if doctors are not being supportive enough, contact me and we're going to find a way of getting them engaged. That's part of my outreach campaign right now. Let's move on, Teja, because it's getting very rich. So let's see if we can cover something else. Let's take a couple deep breaths just to change the experience from one cognitive matter to another. So to renew our thoughts, we bring the attention to the body, we can twist, we can breathe, we can move our neck and perceive other visual stimuli. Are you doing any of that?
Yeah, I took some deep breaths and I twisted and I'm looking around the room now.
Okay, I'm sorry I didn't see you. Okay, great.
No, you're okay.
Ah, okay. So you also mentioned one of the things that we have to navigate during professional development, academic life is balancing time off, relaxation, fun, pleasure, rest, being in bed, just turning off the mind, the academic mind, like turning it off and saying like now is the fun mind and now I'm gonna rest and I'm gonna sing and I'm gonna play. And then you mentioned there are stigmas that come from society and expectations and rules and all these things that prevents the cognitive mind from resting. And then we start feeling a storm, like the emotions get like, okay, what do we do? And then the body is kind of trapped in. Tell us about the lived experience of this struggle to see if you, from your wisdom, can provide us some guidance for people who do not do the integrative work that you are doing so well. Feel that struggle and bring the question, what is the right balance? Ask your body, ask your emotions, ask your mind. Feel it a little bit and the wisdom will sprout. Just
You
focus on,
know,
uh-huh.
I think it's interesting because certainly don't consider myself an expert and it's an ongoing learning process for myself that I mess up all the time. Um, I think the interesting part about it is how the role of others around you can sometimes play. So um, when I was in all throughout elementary school, middle school, high school, kind of growing up, was in kind of an accelerated program, and I was surrounded by people who really, really cared about school. And it was honestly kind of a toxic environment in terms of how much academic achievement was emphasized in terms of like worth, and how much work we were expected to do, you know, as 12-year-olds and moving on, and also the expectations teachers put on us. And it was so normalized that I never had exposure to anything different, if that makes sense. Um, so it's something I've struggled with a lot, like in retrospect, looking back at things like that. Um,
Tesha.
mhm.
Now, when you look back at it, at that way of expectations, toxic academic achievement coming from teachers that was affecting your 12-year-old well being,
Mhm.
what would you say? What would you do? What are you saying now? What should be different, and how should we encourage 12-year-old kids? Going back to that question, what's the right balance? What are you saying? What would you say from your body, from your emotion?
Um,
In the body, down, lower,
yeah.
feeling. Uh-huh. This is good. Researching. Nice. Chest,
I'm trying.
chest,
I
chest, shoulders, maybe here, maybe the stomach, maybe the legs, maybe the hands. Get the opinion of the body. How much rest? How much like time off? The opinion of the emotions. One at a time. Don't rush to the cognitive conclusion. Take it piece by piece.
I guess I'll start with like the emotional impact, but I would say emphasizing worth outside of grades, outside of how much effort a student is putting in, and rather the person as a whole, I think is something that's really important to do as a person is developing. Um, so I think emotionally, when you're being told like, you know, a huge part of your worth or your future is in how much work you're putting in or how much academic achievement you're experiencing or achieving, can be really difficult, especially at a young age, and can make confidence really difficult, if that makes
Okay,
sense.
I think you got this is what happens. Any big existential questions that the mind is like, I'm figuring it out, and
Yeah.
society is figuring it out too. Is the felt sense, is the body, the basic needs, the basic health of the body and the emotions, and you said it. It's really difficult. So when we feel that in the body, in the emotions, this is really difficult. We know that, okay, we need a break. This is the moment to relax, move
Mhm.
away from whatever is being really difficult.
Mhm.
So we need to feel it in the body and in the emotions and kind of search it down. And when we feel that difficulty, that discomfort, trust that that is the message. Now, what's going
Mhm.
to happen? It may be happening in you now, Teja. Check it out. That when the body talks, the mind receives the information, and the mind is hearing me and saying, maybe any other resistance from society, from previous learning to resting and relaxing and feeling how difficult it is and moving away. What is the mind responding to what's coming up from the body and the difficulty?
I think it's my I cognitively struggle
Mm-hmm.
with how much I do enjoy school, like genuinely, authentically enjoy school.
Okay. Okay.
If that makes sense, and the two
Yes.
coexist hard.
Yes. This was another question that you brought up at the beginning that I thought we were not going to get to. But the love for school, hey, I feel it too. I'm a nerd. The love for work, the passion, the love.
Mhm.
And you tell me it's my emotions. I love it. And my mind is so
Yeah.
engaged. I love it. But then who is like, guys, the body is like, guys, I
Yeah,
need
everything
rest.
in moderation.
I
Yeah,
get I get migraines, I get lower back pain. The body is like,
yeah,
hey, the creator
exactly.
evolution hasn't made me the body yet, right?
Yeah. It's a hard balance.
To feel the body. We have to recognize our incapacity. What are
hmm
we gonna do?
And I had a realization the other day, but I was very fortunate to have like 5 days off randomly last week, like Wednesday through Sunday. And I had like a long list of things that I was planning on doing. to prepare for this week, which was going to be more intense. And I worked most of the day Thursday and then just genuinely didn't work the rest of the days. I mean, I worked a little on Wednesday, but Friday through Sunday, I did nothing. And I came into this week kind of nervous about it. And it was actually the perfect thing I could have done because it's, about halfway through the semester. I'm burnt out. I got what I needed to done on Thursday. And I came into this week kind of refreshed and ready to go. And I think if I had forced it, I
Actually,
think this week much harder and I wouldn't have done as well.
let's feel
Yeah.
that because this is the new
Yeah.
reward.
Hmm.
Feel it, feel it, feel it, feel it, feel it. Feel the reward. You are becoming your own healer. You get it, and your body is responding well, and the emotions. And I'm actually more refreshed. This is nice. And then the nervousness, the worry, the anxiety slowly dissipates. And then
Hmm.
you trust it, and then you get it, and then you're making even better progress. Celebrate, feel it. So let's see if we can answer the question now. When to take time off? What's the balance? What would you say now?
How I think it depends how you're defining time off. Like if it's like, I need a day off, I'm going to take a sick day versus like, the considerations of like taking a medical leave or, taking longer term.
Let me add another definition, Teja.
Mhm.
How
Okay,
about
yes, there are many ways to define it. Yes,
taking, I don't know, a few hours a day?
absolutely. Yeah.
Maybe taking half an hour a day, maybe taking 15 minutes a day and playing and jumping and running, maybe taking 2 hours and hanging out, like maybe going to bed early. Like you're right. There are so many. But do you think it should be daily, a little bit of time off daily, or do you feel it should be like once a year? Or guys, a little bit of time off daily. It's okay. What do you think?
I think taking time off daily makes the most sense because you're not going to, when you aren't taking that time off to rest and recover, when you get to a point of taking a day off, it's probably out of desperation rather than like, it's escalated versus if you integrate it in your day to day, or maybe not even as frequently as day to day, but more frequently than just, one day off,
That's
kind
it.
of off. Yeah.
You got it. You got it. We're answering the questions that science have not yet defined. Who is answering them? You. Why? Because when we get functional discomfort, it means that we're awakening. We're designing society, recognizing that, hey guys, it makes sense that every day rest and chill and relax a little bit, not to fall into desperation and end up in the doctor and in the hospital. So
Mhm.
you are reminding people of this. Okay, we're getting to an end. So feel how the energy goes, like, whoa, excitement. Whoa, okay, let's see how we can bring it down. Let's do something. But also, I think it's also getting used to the happiness of it, right? Like associating the highs, the high
Mhm.
energy, not with the stress, but with happiness, with I'm doing it right,
Absolutely. Yeah. Yeah.
I'm getting this, I'm learning, like, oh, I'm surfing, right? The electromagnetic energy of the nervous system. I am learning how to surf it. Okay, let's observe the energy. Start getting ready for the sh- the check-in, the final check-in, saying goodbye and all that. You can move, you can do whatever you want for the final check-in, saying goodbye. I just want to say thank you, Teja, so much for partnering up with me and talking about these things. And I thank everyone who watches the video and shares it with someone who may need it, especially adolescents and people in transition. I'm going to mute myself and I'm going to let you finish and say goodbye because there is some truck here.
Yeah, thanks everyone for coming. I hope you benefited from it. Yeah.
Okay, see you again soon, Teja.
Bye.
Stay connected. See you, everyone. Bye-bye.